your treatment, there is an antitoxin for it, but I haven't seen very many cases that have gotten over it. Anti-inflammatories and supportive care, but the biggest thing is to vaccinate. This is your 7-way. Have you ever heard of Covexin 7 or Covexin 8? Or when you blackleg your sheep and goats, this is what this is. If you vaccinate for it, that's the cheapest way and the best way to prevent it. Also, when they're really young and they haven't been vaccinated yet, don't pour the grain to them. Again, that's a buffet for their intestines. But you do want to creep feed if you do that. But vaccinating is key. If you are raising your show goats, it's best to vaccinate your pregnant does about 4 weeks before they're supposed to kid. And the reason why you do that is that at the last month or so of their pregnancy, they start developing their colostrum. That's their first milk, which provides all the immune system for that baby when the baby nurses the first few hours of life. So it'll pass on antibodies to take care of enterotoxemia or clostridial disease.
Is that in your CDT shot?
Yes, that's what the C and D is.
Okay.
The T is the tetanus when you band them. So you vaccinate kids as early as 4 weeks, and you give them boosters. For my sheep, I usually band the first few. I'm sorry to keep talking about my sheep. I know this is a goat thing, but they're kind of similar. When I band my babies, I give them a CD&T because it's taking care of the tetanus part. Okay, and then about a month, when they're about 4 weeks old, I give them their booster. Okay, to take care of the C and D part, okay, the clostridial part of it. And I vaccinate them yearly after that.
What's the dose that you give the kids?
It depends on what brand you use. If you use the Covexin 8, it recommends 5 on the bottle for the first dose. I think that's probably too much. I usually give them about 2 for baby kids, the little small kids. But always follow the directions. That's Covexin 8. But always follow the directions on your vaccine. Pictures of kids being cute here. Parasites. This is the most common health problem we see in our practice in terms of goats. It's a major problem. Goat herds suffer with great economic loss due to parasitism just for the reason if they're heavily burdened with parasites, they're not going to gain as much weight, and that weight ends up being money for you guys. And for that matter, it's an ongoing battle for small ruminants, period, sheep and goats. Some of our common parasites that we see, nematodes, cestodes, trematodes, and coccidia. Our biggest killer are nematodes. Homuncus. Homuncus is a bad word for goat people. It's our biggest culprit. It's often called the bankrupt worm. Others that we see, Ostratagia, Trichostrongylus, Nematodiris. These are all voracious bloodsuckers. They're found in the abomasum, which that's the true stomach of a ruminant, a sheep or a goat. Here's some pictures. This is actually right here, Homuncus. These are some Trichostrongyles, and I believe this is Ostratagia here. But that's how big they are. This is, I think it's a quarter. Not sure. But they are terrible, nasty, vicious creatures. Here's pictures of what some of the eggs look like. Here's Homuncus right here. I looked at a fecal slide this morning of a goat, and he was loaded with them, absolutely loaded. So what are some of the signs you see with a goat with parasites? Well, weight loss. That's one of the first things that you see. They can be anemic. I'll show you how to determine if they're anemic or not. They have diarrhea. They're just kind of unthrifty, and sometimes they can just be lethargic. Here's one here, and I'll tell you, that's thin. That's very thin. This guy here has something we call bottle jaw. Can you see that right there? It almost looks like the face is swollen. What happens is when they suck so much blood, they're sucking all the protein out of their system too, and protein in terms of like physiologic matters kind of gets all thrown off and starts going to places it shouldn't, so it kind of collects right here underneath the jaw. This guy here, he's no longer with us, but one way they determined that he was anemic is looking around the tissue around their eye, and I'm going to show you guys how to do that. And see, he's just as white as his ear tag, which is bad. Another gruesome picture, sorry about that. But this is the stomach And see these splotchy pictures here? That's where worms were attached, just sucking the life out of this poor goat. How do they get parasites? Fecal oral. They graze them off the ground. And then it just goes through their system and they get pooped back out. So here's a picture here of Homunculus, our nasty, nasty guy. What happens is they start out here, the eggs are passed, go from egg to different larval stages. The larva is in the grass. The sheep or the goat will come by and it eats the larva that's off there. They'll go into the body. They'll go to the abomasum, that true stomach, and start to develop, and they'll start passing eggs. It's just a vicious cycle. How do we diagnose it? Oftentimes it's just clinical signs, what they look like. They have the bottle jaw, or they're really thin, or they're pretty anemic when you look at their eye color. Or we could do fecal float, to what I did today with that poor goat. Treatments, there are all different kinds of concoctions that are out there, from passed down from one goat herder to the next. I'm not going to advocate one brand over the other, but there are numerous brands, there are numerous routes of administration, numerous protocols, and it's best to treat, the best way to treat is if you look at your clinical signs and you do a fecal float and determine what parasite is causing the problem. That'll let you know what type of dewormer to use. I will say this, I went to a small ruminant meeting up in Minnesota, and they're advocating going back to injectable dewormers. Our oral dewormers, I know probably some of you heard this or have actually done this, taking Cydectin, the cattle pour-on dewormer, and giving that orally. We're starting to see some resistance with Cydectin. The reason why is because it's a cattle pour-on. The adjuvant that's in that, it's not made to be ingested, so they're not getting the appropriate amount of the moxidectin, the dewormer in that, is causing resistance. So we may have been underdosing them, which leads to resistance, okay? So Cydectin has a sheep drench now, so if you do decide to use that, that's what you need to get. And I'm pretty sure you can get it from a co-op.
If it says sheep drench, does that...
Now you can use it on your goats. You can, yeah, you can use it on your goats.
Injected.
That they have an oral, but they're pushing for injectable, which means go to your Ivomec. Okay, they did some studies. The Small Ruminants Association, they did some studies and found that injectable dewormers are working better. They get about 80% of the worms versus others. Your oral dewormers don't work just quite as good.
Do the drenches hold their own as far as being similar?
I think they do. I think they do. The problem is it's not that the Cydectin's not working. It's that it was not made for, it's made for a cattle pour-on, but we're giving it in the mouth. That stuff is, and I can't imagine swallowing that stuff. I mean, it burns my hand when it gets on my hand. So, giving it to a goat, would they think that to the adjuvant that's with it, we're just improperly dosing them? That's why we've had some resistance. So, but now that we have resistance, the bugs know, the parasites know what moxidectin, Cydectin is, and it's not killing them. So that's where our problem is. But I think oral dewormers work. Yes, I'm not saying don't use oral dewormers. Your Synanthic, your Safeguard, your Panicure, all that, I still use those. I still use them.
Sorry.
Go ahead.
We just got through orally drenching with that too.
Okay.
Is there, like if we're going to inject it, is there a certain type that you get for it?
It's just an injectable that you got for cattle and swine. That's what you want to use.
Buy the one that's for injection.
Yes, that is the injectable.
Dr. There's only a question over here.
Yes.
You said the sheep drench. Are you saying that that's only to be injected or given orally?
No, that's orally. I'm saying, but if you've got a really severe case of parasites, one that looked like that one up there, you want to use your injectables. I just want to let you know that Cydectin has an oral drench now, to use that oral drench and not to use the pour-on for oral use. It's a sheep oral drench.
How many
Yes.
cc's do you get?
I believe it is 1 cc per 11 pounds. It's on the bottle, though. It's on the bottle.
Is there a pour-on for goats?
Not that I know of. Not to my knowledge. Not to my knowledge. Not that's labeled for them.